A diagnosis of breast cancer can cause a life-changing ripple effect of impact, affecting those we love the most and those upon whom we lean for comfort and strength in the most challenging of times. My name is Aisling Hurley and I'm the CEO of Breast Cancer Ireland, and you're listening to More Than a Lump, a podcast that talks openly and honestly to a selection of guests about their very personal connection to breast cancer, be it through their career choice, their own first-hand experience of the disease, or through sharing the experience of close family members. My conversations will centre on how breast cancer has informed their perspective on life, love, family, health, their goals, and indeed their aspirations. Although each story is utterly unique, the one common thread that runs through each one is that breast cancer is more than a lump. Professor Arnie Hill is the chairman of Breast Cancer Ireland and head of the School of Medicine at the Royal College of Surgeons in Ireland. He is a general breast and endocrine surgeon, and I first met Arnie in 2007 when I joined RCSI as Director of Development. Over the past 15 years, and through the establishment of Breast Cancer Ireland as its independent charity in 2011, he and I have experienced many great advances. As the National Advisor for Surgical Oncology for the National Cancer Control Programme, he's also Lead Clinician with the new breast centre located on the Beaumont Hospital Campus. This centre, which is due to open in the summertime this year, will cater for over 10,000 cases presented. Arnie, you're very welcome to More Than a Lump. I'll bet you didn't know what you were letting yourself in for today, for your very first podcast. But as always, you're up for a challenge and always there to support us in every endeavour at Breast Cancer Ireland, whether it's cycling, running, jogging and even dancing. You continue to do whatever is needed to raise funds for research and to drive awareness into this awful disease. So thank you. I suppose to get started, what would be very interesting to know is why breast cancer surgery? Why surgery as a career path?
So if I go to why surgery first, when I was very young, I always liked doing things with my hands. And, when it came to medicine, I thought the results from just medicine, like giving tablets, just wasn't quick enough for me. And when you did something surgically, you made it better and you had instant outcomes. And that just really appealed to me. So working with my hands, and also, as a surgeon, one of the most important things you do is decide who not to operate on. And that's still a really important part of our surgical career. So operating is one thing, but the harder decision is actually not to operate. So then you ask, why breast surgery? Well, when I was coming to the end of my career, you are forced to choose a specialty because that's the way we've gone in society and in practice, that people specialize in an area to get super good and be the best at it. So when I was thinking of what career to go into at the time, you have to think back, there was no screening program in Ireland. There was no centralisation. There was no specialist breast services. There was probably one clinic in St. Vincent's at the time, which is where I trained as a student, and I saw it and I thought it was really interesting. But the fascinating thing that got me going about breast surgery was, number one, I loved that there was a lot of communication with patients. So it's quite challenging still to talk to a patient and that awful moment of having to tell them that they've breast cancer and how you do that. And I still work on other better ways we can do that and how I as a doctor can actually make that softer and nicer. So imparting information, it's still a challenge and I still try to improve on that. And that appealed to me, that communicating with patients, because it's really important to me. Anything about my job, I just love interacting with patients and with people. So that was really important. That was a nice side to breast surgery. And then the breast surgery itself, it wasn't as organized as it should be in this country. And as I say, at the time, there was no screening program. There was no symptomatic breast clinics. There was one breast clinic in the country. And then the other side of the whole breast cancer story is something that we can study very well. It's an area of research that has huge potential because you've large numbers. It's not a rare tumor, and that actually makes it easier to understand the science. But what it needed was coordination and collaboration. And that's what I think we've done over the last 20 years to help our understanding, is have a coordinated effort with large number of patients to understand this disease better.
And I suppose if we look now in today's world, in this year, 2022, there has been massive advances. I mean, if we look, survival rates, they have improved. Yeah, they're up at 85%. We can still do more. But now we know that each patient diagnosed has a personalised treatment plan.
Yeah, I mean, that's exactly it. But let me just go back and tell you a little bit more about the advances, because remember I said to you, there was no screening program, there was no symptomatic breast clinic. And in fact, when the final decision as to why I went into breast surgery was, at the time, Michael Noonan, who is now a very elderly minister, at the time was the Minister for Health. And he announced that a breast screening program was going to happen. And that was way back in 1997 at the time, no, actually 1994 when he announced it. And I chose then to go and do a specialist breast fellowship in Memorial Sloan Kettering in New York, just to, well, it's the best centre in the world. It was a fantastic training opportunity. But I knew that politically they'd committed to a screening program, and one day there would be one. And in fact, I'm very grateful to the screening program because it gave me my first job as a breast cancer surgeon in St. Vincent's in 1999. And I can tell you, when you're training in surgery, to get your first job, you're always very grateful. So I thank Michael Noonan and the political force that created a screening program that actually made an extra job for me. So I spent 7.5 years there, and that screening program was fantastic because it was picking up early breast cancer. And the one thing it did was it organized breast cancer services. It was well funded, and it made the screening program was really, really well structured and improved the uptake of early diagnosis of breast cancer, which immediately had an impact on survival. We were picking up cancer at an earlier stage, which was just brilliant. And then the spin-off of that was that the symptomatic service, that's patients who feel a lump or have a symptom, that was totally disorganized. And I was working in a system with a first-class screening program, well-funded, and an appalling symptomatic service, that there was no funding and no organization. And we took it upon ourselves, a whole group of clinicians, to say, we can't have this. And that led to, the times of when Mary Harney was Minister for Health, and she brought about centralization of breast cancer services. And that was really painful because a lot of change is really painful for everybody. But it has had a great outcome on improving the quality and the standards of delivery. And it actually forced the government to resource public symptomatic breast clinics. And we've 8 of them, and they work really well. Now, not everything's perfect, but where we were 20 years ago, this is so much better. We now have organized care, we've standards that people must adhere to, and we've a lot of people working who are actually focused and specialized on breast cancer care. So it's been an amazing journey. Things have really transitioned and improved all the way. Can we do better? Absolutely. There's always room for improvement. That's what I want to continue to do.
And do you think we are getting closer to that ultimate aim, which is Breast Cancer Ireland's, of transforming the disease from often being fatal into a long-term treatable illness?
The simple answer is yes, and I wish it was quicker. So here we are in 2022, and I will say to you that if we divide breast cancer, it's not one disease. There are a number of them, and if I could tell you about 2 particular cohorts. The first cohort, which is about 20% of women with breast cancer, is those who overexpress this marker called HER2. It's a receptor on breast cancer cells. That's a subgroup. 20% of our patients have this receptor, and we have fantastic drugs that now can achieve up to a 70% complete response rate. That's wonderful. If we could get it to 100, that's 20% of breast cancer cured. Mm-hmm. And I think we're very close to achieving that. We're learning more and more about all these anti-HER2 drugs and how they work and how they're more effective. And that's one particular clinical trial that we're really excited about opening next year or this year in Beaumont and in other hospitals in Ireland, to try and learn more about how we can get that 70% complete response rate up higher. 100% is the goal. I don't know will that be in 3 years or 5 years, but we're really close to it. And that's one subsection of breast cancer sorted, I hope. And then there's the next exciting group, and it's just worth hearing about these 2 groups because they're going to be the first 2 groups that are going to be effectively, the disease will be transformed from being one that kills to being a chronic illness. So I think HER2 positive breast cancer is the one group that will do well on first. And then the other group that's way behind but needs more work is the triple negative. And if I can explain that term, that's people who have breast cancer where they don't have any of the 3 receptors on their cell. And they're a separate cohort. And we're making progress on that. We're getting better drugs. And that'll be the next group, I think, to make real progress on. Meanwhile, on the other remaining parts of breast cancer, I think we are making progress. We're not quite there at saying we've cured it. We're not quite there at saying that it's turned into a chronic illness. But I would say over the next 5 to 10 years, we'll certainly recognize that survival will increase more. I mean, we talk about for early breast cancer now, stage 1, we're talking about 95% 5-year survival rates. And that's pretty good. For those who are node positive, 20 years ago, we said it was about a 65, 70% 5-year survival. We're up at 85%. Now, obviously, you've got to look at everyone's individual case, but those figures are improving, and they're improving for a number of reasons. 1, earlier detection. 2, better drugs. 3, a more organized treatment program across the country. Sophisticated diagnostic imaging centers where people are focused and specialized on it. So there are improvements going. The problem is to complete the job. And that's what we need to do. And that's what I think the work that Breast Cancer Ireland are doing in raising funds to really drive those changes are really important. And in fact, if you ask me what should we be focusing on? I think it's about focusing on clinical trials. And clinical trials is where we organize and ask important questions with new innovations and new treatments to learn about what improves outcomes for women with breast cancer. And in fact, as you know, we've opened this new unit in Beaumont Hospital. Intrinsic to that is a clinical trial centre. So there's 3 floors. First floor is imaging, second floor is clinical outpatients, and the third floor is clinical trials. And it's that integrated unit that should be the norm.
And I suppose it's also, when we started Breast Cancer Ireland back in 2011-12, one of the key things was how could we speed up scientific discovery output and get all that into clinical trial for ultimate benefit of the patient. And I think we are certainly making headway in our specialist breast research nurses in the designated cancer centres. They are collating and collaborating and building a national bio resource, which is fantastic. So the clinicians and scientists can work on their research and the output is there. And we're looking at publications that are definitely increased like 200-fold, which is great. It's now getting that output into clinical trial.
Yeah, it's about the coordinated effort that's there. The infrastructure is there. The coordinated collection of tissue, of blood, that we can actually learn faster. Because if you've got greater numbers, you can learn faster. And that's what we're doing. We have a large biobank of 4,500 patients. That's going to allow us to expand our knowledge far quicker than before. So think about 20 years ago, we didn't have that. We do now. So discovery is faster. But, we're on a really exciting journey. It's about completing it. Yeah. We're on the last lap, I think.
Absolutely. And on that note of excitement, the new breast centre on the Beaumont Hospital Campus is soon to be open. Tell us a little bit about that.
Well, that's, as I said, the design of it is, imaging on the first floor, clinical exam on the second floor, and on the third floor, a clinical trials unit, all integrated, breast care nurses, administration, the whole thing in one journey. It's also a fantastic facility. We focused on luxury because I think I learned this actually way back in America, where I saw in Memorial Sloan Kettering, at the time, Evelyn Lauder came and actually just made the outpatient facilities beautiful. She just put in the best furniture, the best decor, and that's what we've done in Beaumont. We're 20 years behind, but we've made a really nice facility. Because I think a woman who comes in with a lump on her breast, that journey shouldn't be in a cold clinical facility of a hospital, shouldn't terrify them. It should be like walking into our living room, and it should be nice and a nice environment. And that's what we focused on. So I think that's an important thing to focus on the individual journey of the patient and try and make it as pleasant as possible. And in fact, if you take the 10,000 women a year that come to the breast centre in Beaumont, the vast majority, over 9,000, are benign and fine. It's the 450 cancers that we diagnose. They're the people that obviously we're all about. But remember, the vast majority of people coming through that building, it's benign and they get reassurance.
They're worried well.
And that's important, that they have a nice journey.
Sure, absolutely. And I suppose the last thing I just want to ask you, Arnie, is the impact of COVID on breast cancer that you have seen over the last 2 years.
So it's very interesting. Our numbers of breast cancer continued an upward trajectory. So breast cancer did not go away due to COVID. One of the unfortunate downsides of COVID is I think there were a lot of people, and we know that each year we would see maybe 6 or 10 women a year that would just completely ignore their breast cancer and would present at a very advanced stage. Now in COVID, those numbers doubled, and that's unfortunate. So that was one thing that we did note, that more people were scared to come in and present themselves with a lump, and some wait at a very advanced stage. So in that really small category of locally advanced breast cancer, where normally we'd have 6 to 10 a year, we had about 20 a year in 2020 and 2021. Mm-hmm. But the other important thing that happened during COVID is we still saw patients, we still saw all the people who had symptoms. Some were a little bit delayed in coming, but the number of cancers still increased. Now that might be due to the, in the region that we serve, the population is increasing. Mm-hmm. So we were up at 425 cancers last year, and I think that will go up again next year. Mm-hmm. So COVID was very difficult for the staff. Mm-hmm. There were a lot of staff out with COVID at various times, and that made it difficult. Mm-hmm. In the very early days of COVID, when there was great nervousness about the safety of operating, this is in March 2020, we did decline doing reconstructions, immediate reconstructions. I can tell you that all the women who didn't have the reconstruction at that time have now had them. Mm-hmm. So we fixed the downsides of COVID. So that was a tough time when we were very nervous about operating on anyone. We knew we had to operate on breast cancer. We did delay some people. We put them on medications to try and delay until we learned that it was safer to operate. Because it was a very scary time back in March 2020 when we knew nothing about this virus and how safe and how dangerous it was. But we've learned a lot, got through it, and we're back on track treating breast cancer as we should. And I think COVID is becoming less prominent. It's not gone away, but less problematic.
And I suppose one of the positives I remember you saying 6 or 8 months ago was that protocols and safety measures within the breast clinics is absolutely fantastic now, because there is no long waiting room lists or 60 people in a waiting room. It's roll in, roll out. It's very, very efficient and very, very safe.
Yeah, that's one of the good sides of COVID. It made us organise ourselves. You don't have a waiting room with 40 people in it anymore. You actually only have 6 chairs. Yeah. So organise yourself and make appointments work on time. So it forced the administration of the service to be improved, and that's a good thing, a good spin-off from COVID.
So Arnie, just to conclude, what would be the key messages that you would give to anyone listening today in relation to any abnormality, any of those 8 signs and symptoms that we talk about on a regular basis? What should they do if they spot an abnormality?
First of all, don't be scared. See your GP. If you're concerned, go see your doctor. Please don't delay. Come, get looked after. In the vast majority of cases, it's about reassuring, and that's really worthwhile. But don't be hiding something. Come, present, and we'll sort things out. Mm-hmm.
Thank you very much, Arnie Hill. And just to recap, one of the key things from a Breast Cancer Ireland perspective is that we would encourage women to download our app, which is free, across Android and Apple, called Breast Aware. It sends a discreet monthly reminder to your phone, shows you a simulated video guide on how to perform a breast examination, and outlines the 8 signs and symptoms. And it is available at Breast Cancer Ireland, the Breast Aware app. Thanks a million, Arnie.
Thank you.
The information in this podcast is based on the personal stories of those we have chatted to. If you are concerned in any way, please contact your GP immediately, or you can contact us at breastcancerireland.com.